Hi, my name is Jessica Robinson. I'm the Chief Platform Officer with The Garage. We have another session of the rewrite. And just to kind of rebrief us on what the rewrite is, we want to have quarterly conversation series, not necessarily a podcast, not necessarily a webcast, but bringing leaders together who are actively rewriting the rules, expectations, and the outcomes in healthcare. What we want to focus on is rewriting the game, not necessarily just the rules, rewriting the status quo and rewriting what healthcare can become. Each episode that we have is going to feature a new theme, new voices driving behind meaningful change within and across the industry. So today in our episode, we're going to spotlight our 2025 Be Bold Award winners. Very exciting to have everybody with us today. Our bold leadership in changing healthcare from the inside out. So that's what we were looking for. And we have a few of them here today. So let's get started.
Thanks, Jessica. And I'm Stacy Fox, Chief Growth Officer here at The Garage. I've spent my career working alongside healthcare leaders who are trying to do all these hard things in complex systems, often without a lot of recognition. So that's exactly why we launched the Bold Awards this year. These awards were created to spotlight leaders who aren't just talking about change, they're building it, they're improving access, using data in meaningful ways, transforming value-based care, and showing up on the front lines where care actually happens. Today, we're recognizing the first Be Bold Award winners. So, like Jessica mentioned, leaders who are working to rewrite what healthcare should look like. So we'll start by having each winner introduce themselves at a high level, and then we'll dive in deeper into their impact and lessons they've learned along the way. So Kayce, I'll start with you.
Thank you for having me. I really appreciate it. Hi, my name is Kayce Degenhardt. I'm the Vice President of Clinical Applications at Inova Health System in Fairfax, Virginia. I lead our clinical technology strategy and focus on stabilizing core systems, aligning technology to operational needs, ensuring frontline clinicians are equipped with the workflows that they actually need to support how care is delivered. My passion in healthcare started very early on when my mother got sick, and I firsthand experienced what it was like to go through the system and where efficiencies could be made from a patient aspect. So thank you for having me.
Thank you. And Jena?
Hi guys, how are you? My name's Jena Quinn. I am the CEO and co-founder of Perfecting Peds, which we will get into what that is. But I've been a pediatric pharmacist now for 14 years, practicing prior at the Children's Hospital of Philadelphia and Cooper University in New Jersey. You will hear my terrible Philly accent come out. Also, I am a mom of 3 wonderful, fabulous little girls that keep me going. Peyton, Hadley, and Avery, 8, 6, and 3, and they inspired me on this mission. Similar to Kayce, my journey is extremely personal. My sister suffered from epilepsy all throughout her childhood. I was 10 years older, so I was quickly the third unwanted parent. I tried to be the cool mom, but the 10-year gap, I saw firsthand just how that can affect the family, making sure that everyone in the family was educated how to give the emergency medications, make sure that the medications were effective and appropriate, but also weren't having side effects. And also seeing firsthand, my mom tried to advocate to get medications changed because of toxicities. And my grandfather, being a pharmacist, kind of meshed those two passions together to be a pediatric pharmacist, which really keeps me up and going every day. And it's also very easy when at the root of your mission is a child.
Absolutely. We can all relate to that as well, Jena. And Kayce is our Frontline Trailblazer Award winner, and Jena is our Data-Driven Disruptor Award winner. I'll hand it back to you, Jessica, for the Frontline Trailblazer Award winner.
Yes. So the Frontline Trailblazer Award honors leaders transforming frontline care by empowering clinicians, elevating patient experience, and ensuring technology supports those delivering care at the point of service. This year's winner is Kayce Degenhardt, and is recognized for her exceptional work rebuilding trust, reshaping systems, and centering frontline realities in clinical technology. The quote we have from her nominator was that Kayce is a true frontline trailblazer because she makes transformation real where it matters most, at the point of care. Her initiatives are designed hand in hand with the nurses, physicians, and the staff who uses them, ensuring adoption and a lasting impact.
Very, very exciting, Kayce. So we'd love to learn a little bit more about the work you're actually doing. If you want to start by sharing more about Inova, and then our first question to you is, frontline work exposes the gap typically between policy and reality. So what frontline problem did you see that leadership or systems often miss, and how did you solve it?
Sure. So I'll talk a little bit about Inova first. Inova is a system in the greater DC area, based out of Fairfax, Virginia, and spread out throughout the entire region. We have 5 hospitals and over 300 clinics, and growing every day, a lot to keep up with. So when it comes to the frontline problems that we're seeing when I came into this role is, first, I observed, I think that it's really important to listen to what the clinicians have to say and then connect the human and the tech worlds. Each side brain thinks differently. And so you have to have some sort of a bridge or synthesizing of the ideas for the worlds to collide. And so what I saw wasn't necessarily a disconnect between the leadership and the front line. It was a disconnect in how we were approaching our problems operationally. And so clinicians were asking for specific tools, specific fields, and telling us what they thought that they needed. And what it did was create a lot of fragmented pieces of technology. And so what we did is we shifted our mindset to being more solution oriented. How can we work together to define the business need? And then our technology experts could architect and come up with different solutions along with the risks, your pros and cons, represent those to the clinicians and with a recommendation. And then they were able to choose, all right, this is the path we want to go. But it allowed us to have more of a holistic approach versus to say, add this field here, add this field here. And then you have physicians that have 100 fields on their screens and they can't work because they don't know what they need to choose. So taking that approach really helped us and helped the clinicians to streamline their workflows and also to figure out what was actually important to them. And that then we were able to reduce our backlog and really hone in on what was important so we could really focus our efforts in being more efficient and serving the organization versus just spinning and just trying to check boxes.
I think that's something from a technology perspective, our teams are dealing with is kind of the list of things that people want. And then kind of sounds like, Kayce, you and your team were like, okay, let's just take a step back. Yeah. What is the problem we're trying to solve? What is it the ask that's the bigger picture, the bigger need, rather than making little things more specific? What do we need to do that maybe will change that whole flow? So rather than 40 more clicks, how can we make kind of one maybe template that gives them everything they need right where they want it? Because everybody's looking at that a little bit differently from their lens, their perspective, their specialty.
Yes, absolutely.
I think the key too, from a technology spark, it's kind of like, what do you want? Let me give you what you've asked. And then you think about, okay, now we have 14 flows that are all doing the same thing a little bit differently. How can we make this better? I think important thing to understand when we work with those professionals, as you mentioned, their brains work a little bit differently between tech and physician. At the end of the day, we want them spending more time with their patients, but the need or the ask is also important, but that's not necessarily the best delivery. By just adding another field or adding another drop down, right? For your technology and solutions, just in general, what has been the biggest difference, either in an implementation or availability, that has really reduced friction or burnout within kind of your team members on all sides?
So when I came in my team of 200, the biggest thing I heard was we are overloaded and we don't know what our priorities are and we work so many hours and we're not really getting there. So I came in and I put a 3-month project pause in place and said, all right, we're going to stop everything. Anything else new coming in, and let's just start cleaning up our processes. I'm a true believer of you can't pour from an empty glass. So we need to get ourselves into a better place in order to serve the organization. So how do we fix this? How can we standardize some of our processes internally? We were able to work on ourselves for about a year, and then we kicked off what we're calling our Reset Initiative. And it has 164 projects on it, including specialty redesign. So then what we did is we did 3-month sprints through each one of our specialties with full engagement from our service line presidents, full support from our CEO, who meets with our service line presidents and myself every single month to make sure that we are fully on track. And what we did in each one of those service lines is we performed a 3-month sprint that caught up the rest of their backlog and standardized processes for those specialties throughout all of the locations. So we were consistent in our processes. So no matter what cardiology department you work in, your workflows are the same as much as we could. And that has made a huge difference in also offering the tools that are available. So maybe there would be one specialty that would have it and another one that wouldn't, with things like ambient listening. That's a huge time save, and rolling it out for physicians and nurses. But taking the tools that are available, standardizing the processes, going through the rest of their backlog and doing some negotiation, and then rolling that out within a 3-month sprint. We are about 18 months into that process, and we have incredibly high feedback from the organization. I think for our clinicians, we've saved about 35% of their time in documentation unburdening and implementing some of those tools.
That's amazing. And I think that's extremely important thing to remember for everyone is we can only do with what we have. So if your cup is empty, you're done. And so it just becomes kind of a constant fight to get to where you need to go. So sometimes taking that pause and kind of looking at it, say, what is it that we could do? How can we make that difference? How can we get to the goal with a little bit more in our cup? And that 35% rate is huge. I'm sure that there's a lot of staff members that are very happy to have that 35% back in their cup to do the things that they want to do outside of work as well. That's great.
Yeah, and I think so many organizations are trying to figure out how to solve what you're working on as well, Kayce. There's so much data, there's so much technology. How do you make sure you have the right technology and the right data in place at the point of care that is actually helping save time and not burdening the physicians more, and making sure that it's adopted? So that's definitely love hearing that story and love seeing the impact that you guys have made and what's working for you. I hope others find some insights from your story. And Jena, would love to kind of shift it over to you to see, from a data access and technology standpoint, how do you see that show up at the front line?
Yeah, so I was heavily shaking my head and wondering if Kayce wants a job at Perfecting Peds, because we're building our own platform called RX Junior. So this was something that had you told me like 10 years ago, you're going to found a company and it's going to be a tech service company, I'd be like, absolutely not. But, with pediatrics, we don't have a lot of electronic health records that cater to kids. And so I originally 3 years ago naively went to Epic, and they're like, you're a little too small to play in this pond. So I had to figure out, technology, you can't get around it, right? And if it becomes your friend, it helps clinicians so much. So here we have our platform lovingly called RX Junior that we're building on Salesforce Health Cloud, but we're doing all the things too that Kayce's doing. And so, one of the most important things is tracking the efficiency of for us, it's the pharmacists and the care managers who are a mix of social workers and nurses. But we really try to bite off a chunk at a time, just like Kayce's saying. Like, we just focused on our care managers. How do we make things? It could be something so simple and silly, but a lot of doctors prefer their recommendations to be faxed, right? So how do we make that as automated as possible? So now the pharmacists put in through like voice recognition, voice to text. It texts it in through the conversation with the caregiver and identify and pulls out, okay, what are the interventions the pharmacist making? Could it be the dose is too high, it's too low, there's a drug-drug interaction, a drug-food, drug-gene, whatever it is, and pull it out, put it into discrete fields, right? So my tech team lovingly calls my brain they say I have unstructured data. So they call me unstructured data. So they take all my recommendations for this patient and make it structured, right? So that recommendation of starting an inhaled corticosteroid for an uncontrolled asthmatic, how do we turn that into a discrete field so that we can then put a ROI to that? So we know this kiddo's uncontrolled, they are needing steroids often, and that all ties back to an ROI, right? So for that, every what we call care management or drug therapy problem ties back to data that then can set us apart from other organizations, right? So, not only are we tracking, okay, what's the ROI associated with that pharmacist intervention? What's the cost avoidance? What's the direct cost? And then probably where Kayce obviously spends a lot of her time is how do we use every technology available, not burdening the clinicians because technology is not our jam. And if you give us a tool, we're like an old dog, we're not going to use it unless you force us. And so using that and then tracking over time, here's the X amount of minutes we were able to cut down so that ultimately we want to keep the human in the loop, but we want them doing what we do best, which is taking care of our patients. And, being a CEO, unfortunately, I'm a clinician at heart and always will be, but making sure you hit your finances so that your company is viable is a necessary evil while making sure you provide good care and you don't burden the people who matter most, which is the frontline clinicians that are supplying these services and care for the families.
Thanks, Jena. I love that you're called unstructured data and then you won the Data-Driven Disruptor Award. It's like very fitting.
Their work cut out for them. They know that.
Yes. Very important work. And I think looking at pharmacy intervention for any age population, but I mean, especially for pediatrics, me personally having kids working at Children's Hospital for, 8 years as kind of the beginning of my healthcare definitely hits home for me. So love the work that you guys are doing. Kayce, we'll come back to you now for a fun question. What do you feel is your superpower?
I feel that my superpower is being relatable and talking to everyone the exact same way and being able to meet them where they are in their technical knowledge or their clinical knowledge or their operational knowledge, and just being able to understand and listen, decode what they have to say, synthesize it, and then what needs to happen to the other teams that it impacts. And I think that's a really important skill in this industry in trying to combine the tech and the human worlds.
That is such an important skill. And I think of it as being approachable too. Relatable, approachable, such an important skill. Perfect. Well, with that, we're going to shift. Thank you so much, Kayce, and congratulations on your award. We will share out a blog as well, kind of associated with it if you'd like to learn more about the impact and work that Kayce is doing. I definitely encourage you all to follow her on social. And with that, Jena, we'll switch over to you. The Data-Driven Disruptor Award, our unstructured data queen. But the Data-Driven Disruptor Award celebrates leaders harnessing analytics, innovation, and technology to reshape patient care. Today's winner, Dr. Jena Quinn, co-founder and CEO of Perfecting Peds, has redefined pediatric pharmacy through data enablement models that deliver measurable outcomes. In a field constrained by limited access to pediatric medication expertise, Jena is pioneering a model powered by actionable data delivered through advanced technology and built for families. As her nominator shared, Jena's vision, outcomes, and relentless pursuit of pediatric excellence make her a true disruptor. I feel like your nominator should have added the unstructured data part to that as well, but I'm very glad that we discovered that on this call.
I love that. I will say, it's funny that with all the data that I know you're working with, having that as kind of your name, unstructured data, is hilarious. It's funny how your nicknames are kind of those little things that people call you just find you. And it's really like No, that was never going to be my thing. I was never going to work with data. I was never going to work in healthcare. I was never going to work in tech. And it's like, here you are. Here I am. It's, yeah, those things just find you. I love it.
I had to figure out how to harness the unstructured data of my brain and ADHD into structured data. So it's been a 5-year journey, and I'll get
Understand wholeheartedly. So Jena, so which specific data set or insight first revealed a pattern that transformed how you approached the care delivery or population health within that pediatric pharmacy world?
Yeah, so I always joke to parents, like, they're like, what's a peds pharmacist? Like, what is that? And so I lovingly and jokingly say, we are the ultimate dorks in pharmacology and kids. Like, there's nobody else like us, for 10 years through, getting our doctorate to then doing a post-grad residency to getting board certified. There's only 2,000 of us in the United States. And so we really do pride ourselves in being the dorkiest of the dorkiest in kids pharmacology. And so, what basically, as I kind of talked about my experience prior in the hospital, a pharmacist would round on the floor with the doctors. So I was always in the pediatric intensive care unit, the neonatal ICU, or the Peds ER, and I kind of floated. And there, my job was to be part of the collaborative team. So, the doctors would prescribe, and sometimes I'd say, hey, you know what, there's a better option for this diagnosis, for this disease state, for this infectious disease that we're treating, or here's a way we could simplify it, or you know what, we actually can't do that. There's a massive drug interaction, or the examples are endless. So I was their, pharmacology resource on rounds every day, and I would verify and make sure all the orders were correct. And so ironically, the doctor that I worked with for 10 years on the floor every day is now the CMO. And so I got to keep him. But over the years, the pediatricians became my besties. And what I realized was, just from working in the ICU, is that the more complex our kiddos were, the more meds they had, and they were at risk of polypharmacy. We talk about in the geriatric population all the time, so many meds, they're at risk of side effects, but nobody has ever focused on kids and polypharmacy in the US. And where we have these really crazy mandates for a pharmacist to be part of a geriatric team in the ambulatory care space, we have nothing for kids. So basically, I saw a pattern that with these complex kiddos, they were being admitted to the hospital for preventable medication errors. The other problem I was seeing was that, like, these peds pharmacists are only today in an acute care setting. So you only have access to this person that could keep your child out of the hospital and prevent the medication error, but they're inpatient, and that's reactive, right? So I hypothesized that if we took us out of the acute care channel in a reactive fashion and put us in the ambulatory care space, partner us with providers, patients, parents, that we would be able to long-term follow a kiddo and keep them out of the hospital. And so I put my sales girl hat on. I noticed that skilled nursing care facilities in the pediatric population were the ones that I felt like I could prevent from being inpatient the most based off their complexity. And I said, hey, can I do a value-based contract with you? You have 400 medically complex kids in New Jersey that have never seen the care of a pediatric pharmacist. And he said, go get them. So, a year to date, I studied every single outcome, right? So I'm like, how do I make this a scalable model? So first thing we did was look at ED utilization. So from 0 to 1, we were able to prove a 44% reduction objectively of these kiddos' ER admissions and hospital utilization. The second thing I looked at is how many drug therapy problems are there per child of this complexity. And, it could be anything from a huge drug error to something simple as, hey, you got to give it with food. It's not going to work as well without it. And that was 13 per child. Also looked at the provider's recommendation. We can't prescribe. So I wanted to prove, hey, the provider's like this. So our recommendations were 98% accepted. Looked at NPS because I wanted to make sure that the parents and the patients liked us. Ironically, that was also 98%. And then I also attached a cost savings and cost avoidance to each kiddo. So we realized that if you have a pharmacist on your team, ironically, we're able to bring, the average kiddo had 13 meds down to 10. because we are able to span across subspecialties that no one else really is. So we can say, hey, neurologist, psychiatrist, you're using 2 different meds to manage the seizures and the bipolar, but we can actually use one and it's more effective and there's less side effects. And so we actually deprescribed medications that simplified it and prevented adverse drug reactions. And then lastly, we were able to calculate, looking at, now we have a more sophisticated way, claims data, to see that utilization of AmCare, of ER, et cetera. So I used all those data points to publish a study, and then I took it to the health plans and said, hey, you guys have your sickest kids. Can we have pediatric pharmacists embedded in their care longitudinally? And I don't think they would have listened because it's a new model unless I had that data.
100%. Yeah, that's amazing. Those are some great numbers. And I think that's really important. I mean, as parents, you almost feel a little helpless when things are going wrong and you're in the hospital. And with you have a healthcare background, you are at such an advantage, but there are so many that aren't. And you just trust that the physicians are all talking to each other and that they all are coordinating the care. And that just doesn't happen. And I think we see that on the back end because of where we are. But as a regular parent bringing your child in for any type of issue, you just assume, and that makes it really hard to know that there are these things that are out there. And unless you have a relationship with a pharmacist and you can have those conversations, which again, most of us don't, it's really hard to even know to ask the question or to bring it up. So I think that's amazing because it's definitely not something that the patient can really advocate for themselves or ask those questions. That's really great.
Yeah, and as a mom of 3, like I would always find, like, some of it was like small, like nobody asked my kids' weight, they've grown. So we dose all medications on weight. So I'd be like, Avery, my little guy, like doubled in size. Nobody asked, like, did her weight change? I'd have to say, like, hey, she grew, 10 pounds, gained 10 pounds. Like, can you change this dose based off of her updated weight? Or something as simple as strep, like a lot of doctors do twice a day. As a parent, I can't remember anything. So, all the alarms, then you throw it 3 times a day, like, forget about it. There's no chance in hell. So, like, if you look at, like, strep, you can do once a day. So, like, little things that, like, we're dorks and we know this, to make the parents' life easier is our goal. They can call us, email us, message us, and we always say we're their pharmacist in their pocket.
You mentioned a lot of stats, Jena. So there's many measurable impacts, it looks like. But if you were to pick one of those, is it the 44% reduced hospital admissions, drug errors and reactions, care gaps, cost savings? You talked about bringing medications down. Those are all, I would pick all of them. They're all very measurable impacts. But what one measurable impact, and it can be something you haven't mentioned as well, best describes your data strategy success?
So I'm going to kind of probably say something that you don't expect, but I'm like a firm believer that if you provide the best clinical excellence and the best care delivery, the data will naturally trend in the way that you want it. So for me, I know if my team gives the best care in the world, that it will naturally trickle down to every single thing else. So I'll give you my personal, and I'll tell you what the business people care about, is always going to be patient satisfaction. Always, always, always. And then also building that rapport with the family. What builds the longevity of the business as we start going into shared savings contracts like we are is going to be that ROI. So, the clinician in me and then the businesswoman in me have very different 2 different points that I'm watching, but in my heart it's always going to be that, like, my team knows any patient that's dissatisfied gets a call from me, like that, hands down, full stop. We're there to make their lives easier, to make them happier and healthier, and to be their advocate.
I think at the end of the day, it's so important to make sure that your patients are satisfied. I think many of us, I know me personally, carry that as, the work that drives me is, at the end of the day, I know we're impacting patient lives for the better. So to your point, it all, goes back to data at the end of the day, but the real impact is making sure that the patients are having good experience, having better outcomes, improving their care.
And Kayce, from your perspective, how does the data and the insights or, the KPIs drive your physician alignment in kind of your value-based initiatives and kind of in your care? How does that data really push them to do or move in the right direction or whichever that may go, which may be part of their plan or not?
So I think it depends on the initiative and it depends on the outcomes. So I think within value-based care, you do have to be very intentional about it. And where you're seeing your biggest gains, that's where you want to focus a lot of your efforts, or where there's a lot of risk, right? It may not be gains, but there could be that patient risk that you want to take into consideration. And so those are the areas that we really focus on. I think if you try to look at value-based care as a whole, it's like boiling the ocean. And so I think you have to just be very intentional about it.
Yeah, for sure. As soon as you brought up, if you focus on everything, I heard boil the ocean in my head, and that's what you said. So I think we're on the same page with that because there's so many different initiatives and everybody's outcomes are a little bit different. But at the end of the day, you want patient satisfaction, good patient care. You want good quality care for your patients, but checking all of the boxes sometimes isn't feasible in our current state. Patients still need to be seen and documentation still has to happen. So it's kind of which battle do we want to pick today? All right. So Jena, your fun question. Are you ready? If your data set or unstructured or structured were your sidekick, what problem would you help it solve first?
I think and what we're actively solving for, and the thing that 2026 are saying clinical excellence, but really helping the pharmacists decrease any duplicative documentation, right? So and even the voice to text and using AI to be the sidekick and say, hey, we have to be really structured on how we quantify and qualify our drug therapy problems, right? Because we have to relay back. These are our 30 discrete categories that we're doing for drug therapy problems. So dose too high, dose too low, and so taking the conversation of our pharmacists and then pulling it into discrete fields so that we can, not write it in the note and then document it in an additional place, and minimizing the amount of clicks. And really one thing and ironically is what we're focusing on now, is decreasing pharmacist burnout in any way possible and making them more efficient. So that's top of the brain right now. So that's what I'm going to go with.
I think that's great. That's great. So we want to, again, thank you, congratulate you for your win in the Data-Driven Disruptor Award. And I love that this was yours with the label that you have within your organization of being the unstructured one. So I love that. And it's true. I think it's hard to keep track of everything, especially once you become a parent. It's like, what, huh?
I know.
Juggling all the pieces of information and everybody else's belt to load, all of it. It's a lot. So I love that this kind of fell in your lap. I think that's great.
Yeah, and that's why we have a team, right? They're able to pull that stuff out of me and organize me and keep me aligned. So
yeah, very good. Very good. Congratulations to both of you.
thank you so much.
Thank you.
Thank you. We're going to switch to the Value-Based Care Transformer Award. So this award honors leaders implementing, scaling, and accelerating value-based care models. Love hearing that all of our winners are in the value-based care space as well. But Dr. Joshua Luau is our winner. He was selected for his deep expertise in aligning incentives, rigorous evidence, and transforming policy and operational strategies that reshape how value-based care works in practice. So his nominator captured the essence on his influence by saying Dr. Luau is a top national value-based care leader advocating for and working with stakeholders on care transformation through value-based payment and care delivery models. Dr. Joshua was not able to join us today, but you can learn more about his story. We'll share out a blog to see his impact as well. So today I'm going to ask Jena, for you, from a data perspective, what's one value-based care assumption you see organizations get wrong when they try to scale?
So this has come up recently, and without getting too dorky, one of the things that, we've had a little bit of pushback from some of the health plans is we already have an initiative, or we're already taking risk in that population. We can't have your help. And so without getting super dorky. We now use the differences of differences methodology, which is basically instead of you have your normal cohort of patients and then you pluck out the patients that would benefit from your service the most. And despite having that others, they're all care managed. So the health plan will refute and say, well, how am I supposed to tell if it's you or the care managers that are making the nurse care managers are making the difference? And so, we have a great medical economics team and I'm constantly soaking up our actuarial's wisdom, but we have land on the difference of differences. So basically, we're going to we have this group of patients that are high risk, high acuity, medically complex kiddos. Most of the time, we're able to engage. Usually health plans give us a list of their sickest kids. We're able to get 50% of those kiddos engaged in our services. And instead of saying, let's just compared to the whole entire population, we're going to compare it to the cohort or the control kiddos that we weren't able to get a hold of. And so without getting too granular or too in the weeds, the differences of differences have allowed us to kind of layer in our services and find out a way that we're not taking, any of the risk delegation away from a group that's also working with our kiddos too.
We're going to switch over to our Access Advocate introduction. So for the Access Advocate Award, we recognize leaders who are breaking down barriers to rural healthcare and advancing equity for underserved and vulnerable populations. This year, the judging panel selected Brittany Shakdeva, COO of Cibolo Rural Health Network, for her visionary leadership and tireless advocacy on behalf of rural communities. Brittany has been a driving force in ensuring that rural communities are not left behind in the transformation to value-based care. That was what her nominator from her organization said to us. Her work breaks down geographical barriers, financial and technological, so that the rural patients receive the care in their own communities without sacrificing quality. So again, great words from her nominator. And unfortunately, she wasn't able to join us today, but we will go into some kind of follow-up questions with the two of you and really kind of wrap up kind of this session, okay?
Perfect. So Kayce, wanted to shift the question to you. When you look at patients and communities that you guys are serving at Inova, what access barrier do you or have you identified that others overlooked?
So I think the healthcare industry as a whole is limiting itself in what it allows patients to access. So if you book a plane ticket, if you make a dinner reservation, if you schedule a haircut, all of those things you can do right at your fingertips. You don't have to talk to a human. Doesn't take a lot of effort. And you could do it in 10 minutes. In healthcare, sometimes it's really hard to get an appointment. Sometimes it'll say, okay, you picked the wrong appointment. Or if it does allow you to schedule online, or there are...
Or have to wait 3 months.
I must say, 4 to 5, you're like,
Yeah.
Yes, right. So it's not, other industries in consumer access are much more advanced than healthcare is. And so I think it's really important that we're not reinventing the wheel, but we notes from that. And I understand that there are other factors insecurities that we want to keep in place for privacy reasons within healthcare, but I still think it's important to meet patients where they're at. There are some newer tools that help with wayfinding and giving you notifications when you're at home, it's time to leave, but there are industries that have been there for a long time. So how can we help meet consumers where they're at? Because right now they're saying in all of these other industries, I can get food, I can get this, I can get that. I can now get telehealth appointments on Amazon. So why would I go to a reputable healthcare system when I could just do all of these things the way I can access the rest of the consumer world? So I think one of the approaches that we are taking is how to meet patients where they're at and how to give at least that option right now. It's not 100% forcing them to, this is how you have to function. You have to use this kiosk. You have to register on your phone, but everywhere else does that. Self-checkout. So meeting them where they're at, but also really trying to push that technology.
I mean, could you imagine a world where there's like an Expedia for searching for a specialty physician? or like a Google tracker for comparing different rates for different providers across across the country or the state. I mean, it's true. I think that you kind of hit the nail on the head with that one. I mean, we're limiting with so many different steps and kind of barriers to just make appointments. Or, that appointment on Amazon, that physician absolutely is sharing all of the notes and medical records with the primary care physician that was on the sheet. I know it. It's happening every day, right?
Yeah.
But, as patients, it's like, oh my gosh. So yeah, that was a really good one. I like that. It's very true.
The access, especially is so important and bring it back to technology. But just like you said on your last point, we're part of, you actually have to pay. But once you get treatment permission from a patient, we actually curate the data using a qualified health information exchange network. And so, but it's a pay to play, and not everyone's going to do that. And it's going to be fragmented. And so I think allowing a kind of two-step is one for every organization to have that patient's entire medical records. We can see labs, we can see SureScripts data, we can see their doctor's encounters, we know their height and weight. And to think that every provider doesn't have this is wild. And then I'm always going to put in a plug for a pharmacist, because we can, if you have someone in the rural area that's like, I cannot find a psychiatrist for 5 more months. This is kind of where we shine. It's like, okay, well, we're the experts in psych medications. If the primary care doctor can diagnose you with anxiety, we can easily steer that choo-choo train with making sure that medication's the right med, it's dosed correctly, it's being monitored appropriately. And, using those physician extenders in those areas can help the quality and speed of these patients substantially, which was ironically why I'm in PA, is because we're partnering with 2 health plans focusing on the rural families whose the subspecialist is completely out of the question.
So we call this the rewrite. Before we close, I want to hear from each of you in one sentence or one idea. What is the one thing healthcare leaders listening today should rewrite this week? Or advice for the next wave of trailblazers to push bold changes in healthcare? Ideas can be across a process, a mindset, a job description, or something bigger.
I'm going to die on this sword. My biggest thing in healthcare is that, we have these major retail pharmacies with, a lot of people don't know, pharmacists in their curriculum are not mandated to get pediatric education. And on top of it, all kids' medications are weight-based. And so a lot of times a child's script is getting blindly filled at the point of fulfillment without that kid's weight and without the pharmacist being able to check it. So if you're a doctor or a nurse or anyone taking care of kiddos, pharmacists, make sure that weight gets on the script so that we have multiple checks on, is this the right just 101 dose for this kiddo? And that would be the one advice of how we could rewrite, sadly, in 2026 healthcare for the kids.
And I would say tie everything that you do to an outcome. So make your life and your actions intentional and purposeful. We have implemented a new rule on my team that we don't implement a new functionality without tying it to an outcome. How have we impacted healthcare? How have we impacted Inova? What are we saving for clinicians? So everything that you do, just make sure that it is intentional. And when you go back and you look, you have made a huge impact in the healthcare industry. And you don't even realize the footprint that you've made or what you've done unless you track that. So I think that is really important to do.
And it's interesting that is what you bring up on our last rewrite. One of our guests had also said, do the same for yourself. Track what you do, because that helps you to see your impact and your bigger picture as well. So it works across tasks, it works across life, it works across yourself. I think that's really important to make sure that, we check in with ourselves and make sure that, we're also making the impact that we're looking to make at every level. So I think that's a very broad use case, but in a very specific way as well. So that's awesome. We're all aligned here. I love it.
Yes. Thank you, Jena. Thank you, Kayce, so much for your insights, for sharing your impact, and congratulations to you both. Congratulations to all 4 of our 2025 Be Bold Award winners, Brittany, Jena, Joshua, and Kayce. There's a few consistent themes that I saw today. One, I think real change happens closest to patients and the front line. And 2, data only matters when it drives action. Thank you for the work that you're doing every day and for sharing your stories with us.
Thank you for having us.
Thank you for having us.
Absolutely. And thank you again to our Be Bold winners for truly embodying what the rewrite is all about. This series exists to highlight leaders who are actively rewriting what's possible through action, collaboration, and courage. We're excited to continue the conversation in episode 3, where we'll be diving deeper into rural health transformation, exploring how innovation, access, and sustainability come together to support communities that are often too overlooked. If you enjoyed today's conversation, we invite you to follow The Rewrite, engage with us on social, and join us for future episodes as we continue to join the spotlight with people and ideas shaping the future of healthcare. Thank you for spending an hour with us, and keep rewriting.